everyone that we share a very simple common goal, and that is the insurance of Christ Hospital is a critical healthcare provider in this community for the foreseeable future. We've been here for almost 140 years. I can't guarantee another 140 years. But what I can do is do everything I can to make sure that for the foreseeable future, given the incredible pressures that we in healthcare are under right now, and that goes for every hospital in Hudson County, just about every hospital in Jersey and throughout the country, the economic pressures that we're facing now are enormous. And they're forcing us to make some very, very important decisions. Up until this time, hospitals, not-for-profit hospitals like Christ Hospital, like Jersey City Medical Center, other hospitals in the county, have relied very heavily on public funding to make up shortfalls for operating expenses that we have for which we do not have revenue. But there's something that is changing very rapidly today, and I think you all know that because everyone here reads the papers. They all understand that healthcare is undergoing dramatic reform. Some agree with it, some don't agree with it. But the fact of the matter is that everyone agrees with is that there simply is not enough money in the current government system to be able to provide the backbone, the infrastructure, and the foundation for hospitals like Christ Hospital going into the future and to fund those financial shortfalls. We've been very fortunate over the past 6 years that I've been here because we've had resources, our own resources, that we've been able to use to make sure that as we've had shortfalls each and every year, we've had the opportunity through sale of property, other non-strategic assets, our home care program, to be able to generate the revenue so that the money that the state and the federal government have not been able to provide to us, we've been able to provide for ourselves. But the problem we're facing now is that those assets are running out. It's like anything else. You can only spend $1 one time. Once it's gone, it's gone. And we, and I say we, Christ Hospital, the board of Christ Hospital, the Christ Hospital family, is really focused on how do we ensure that we'll be here in the future. Now, sometimes you got to think out of the box. And one of those out-of-the-box thoughts, and it's just happening here in New Jersey, here in Hudson County, it's happening in New York, it's happening across the country, is looking at what the role of for-profit hospitals play in the provision of health care in this country. Now, I'm the first one to say that they're not the end-all, they're not the solution, but I do believe, in some cases, and I believe Christ Hospital is one of them, they do play an important role. For a hospital to survive, you have to have an excess of revenue over your expenses. Because if you don't have that, you can't reinvest in your infrastructure. You can't buy the latest technology. You can't make sure that the roof doesn't leak. You can't make sure that you can pay your staff on a regular basis. All these things require a disciplined and a balanced budget. Now, over the past 6 years, we have very judiciously worked to achieve that at Christ Hospital. And we've come very close. But very close isn't close enough. We found ourselves 3 years ago having an operating loss of $19 million. $19 million. And yet we found ways, some with state support, largely with our own resources, to be able to plug that gap and continue to provide the care, the 50,000 emergency room visits, the 12,000 inpatient discharges, and the ambulatory services we provide. That's getting harder and harder. Last year, our loss was much less. It was $4 million. This year, it will probably be about $3 million. But a loss is a loss. And you cannot continue to sustain those types of losses and sustain your institution into the future. Hospitals are closing in New Jersey. They're closing all over the country. And in many cases, they shouldn't close because they're needed resources in the community. And we believe very firmly, without question, that Christ Hospital is one of them. Along with Jersey City Medical Center, Jersey City being the largest, Christ the second largest hospital in the county. Where do those patients receive service if we're not here? What did we do? We reached out several years ago to Hackensack University Medical Center. But when Hackensack looked at our balance sheet and looked at our losses, and with the other things they're involved in, like purchase of Cascade Valley Hospital, they said, we're sorry, we don't have time or resources to focus on Christ Hospital. We reached out to the St. Barnabas Healthcare System. In fact, our mutual boards, our two boards rather, signed a mutual, not due diligence, exclusive due diligence period to look at the possibility of Christ Hospital becoming part of the St. Barnabas Healthcare System, now called Barnabas Healthcare. The problem arose there that again, because of their, even though we're a large system, because of their delicate, I will call it, financial situation, things they're investing in, they're now looking at University Hospital in Newark. They decided that while we think it would be a good fit financially, we cannot take the risk, nor can we support financially the future of Christ Hospital. We put in a proposal to Hoboken to acquire Hoboken Hospital and merge the two hospitals together. That would have required significant support from the state of New Jersey in terms of millions of dollars of bond issue, which the state has done in the past. And while the state said from a healthcare delivery standpoint it made sense, the state said we are in no position to be able to finance something like that given the extreme stress that the state budget is under across the entire spectrum. So I think it's important for this group to understand that we have done a lot of work to try to make sure that we look at what are reasonable options. And that brings us to the option that I think has raised concern largely because of a misunderstanding about what it means to be a for-profit hospital. And a lot of the allegations that have been made against the system we're talking to, Prime Healthcare, versus the facts, which I'm prepared to provide anyone in the room that wants to look at them. But the fact of the matter is that it is a source of badly needed revenue to bring into Christ Hospital. Just so everybody knows that this transaction contemplates that the acquirer of Christ Hospital will take care of $46 million worth of debt. The debt we owe to our bank, the debt we owe to our pension plan, and other debt. And then, after the acquisition, is committing to, and these commitments are all in writing and will be approved by the state of New Jersey as a condition of transferring the operating license. After the acquisition, we'll invest $35 million over a 5-year period, with $15 million coming in the first 18 months. And again, these are commitments that will be made that the state of New Jersey will insist be kept as a condition of transferring the operating license. Now, in terms of the public transparency of this transaction, which is another concern that's been raised, we are going through what's called the CHAPA process with the New Jersey State Attorney General's Office. And that stands for Community Health Asset Protection Act. And that act is specifically there to make sure that in the case of a not-for-profit community asset, like Christ Hospital, that may get sold to a for-profit entity, that the community asset and the community need is addressed, and that the Attorney General's Office and the Health Department are satisfied that the concerns and the needs are met. So I want to make it very clear to people here that we are going through that process. They need to go through it at Hoboken because as a municipal hospital, they are exempt from that process.
Mr. Kelly?
But we will go through that. So I have to wrap up now because I know my 5 minutes is up, but I want people to understand that this is a process to keep Christ Hospital here, keep it viable, and not only do that, but improve the services that we provide in this community. Thank you.
Thank you.